Back with us today is Dr. Jason Burchard, who is the owner of Inspire Medical Wellness in Mount Juliet, and Dr. Terry Denai, who is the founder of Evexia's Health Solutions. I'm so glad that you're back because we have a very interesting topic that I think I'm interested in, everybody's interested in, is Alzheimer's disease and dementia. Something that we see is ever increasing in our society, right?
Gosh, yes, memory care homes popping up everywhere. And this is a topic that I'm so passionate about, coming from hospitalist medicine and taking care of patients that were suffering from some sort of stroke or Alzheimer's disease. And it's so important to understand the role, especially for women postmenopausally, that estrogen plays in the brain. It is powerfully preventative for Alzheimer's disease, specifically since we're talking about that. It decreases, along with testosterone, a protein in the brain called beta amyloid, which is the hallmark of Alzheimer's disease. And of course, it's an anti-inflammatory. Alzheimer's, we're seeing, has multiple probably sources, but hormone deficiency is definitely, we're seeing, a key cause.
Dr. Burchard, I'm sure that your focus in the clinic when you're seeing patients, especially when they come with a family history of dementia and Alzheimer's disease, is trying to navigate how do you bring the subject up about hormone replacement and its importance. How do you do that?
Well, I get excited when I get to have that conversation, with a patient because, to Dr. Terry's point, dementia and Alzheimer's is, I think we can all agree, probably one of the most devastating diseases that a person can go through, especially on their loved ones. Mm-hmm. And unfortunately, again, as she said, it's been diagnosed, or it's being diagnosed more now than ever at an earlier age. There's still no cure for this, so we have to be thinking in terms of prevention. It's 8-to-1 more prevalent in women than men. Not that us guys are immune to this by any stretch, but we've got to be thinking. The conversation starts with prevention. Yeah. Everybody you talk to today knows somebody that's affected by this. So we have to get in front of it. And a big part of that is understanding the role that the hormones play. And that, for men specifically, testosterone is such a neuroprotective hormone. So it's just so important to evaluate that aspect.
Yep.
And Dr. Denai, you've talked about this in your book, Hormone Havoc, about how estrogen plays a role in brain health. Talk to us about that and why we should pay more attention to this.
Well, I'll tell you, it's so important for women to start hormone therapy as close to menopause as possible. And I'm going to quickly just talk about a study that came out in 2022. And what they did is they did a PET scan on a woman in perimenopause, and then 3 years after menopause, and she had not gone on any hormone therapy. And in this PET scan, they showed 3 years after menopause on no hormone therapy, they could already see the areas in the brain lighting up white with beta amyloid, which is the hallmark of Alzheimer's disease. And this happens years before symptoms kick in. So prevention is key, and early prevention is really the key.
Then, doctor, how do you talk about early prevention in men with testosterone?
Well, I think, again, it's important, again, that they understand that there are so many reasons that testosterone deficiency happens. It's not just strictly an age-related problem. We could talk a lot about with sports today, and
right.
Women are not immune to this either. But sports are, and I'm a sports guy. I love sports, but sports, it's more physical than it's ever been.
Right.
Fortunately, again, I think there is more safety protocols out there today. But if you go back a few years, a person could go through a concussion and give them some smelling salt and you put them back out there. And what we know today is that when you have a concussion, not only does it disrupt gut health, which we can talk more about later, but it also, again, increases your chance for that plaque buildup that she talked about. It absolutely increases your risk for eventually dementia and Alzheimer's.
Right.
So it's important to have these conversations and again, early detection, test it and get in front of it.
That's right.
Well, doctors, thank you so much for sharing this valuable information. Things for us to look at and consider as we go and talk to our doctors or come see you all.
Appreciate it.
Thank you so much for your time. I'm going to send it back to you.